My name's Dr. Bernie Crowther, and I'm here today to talk to you about the sacroiliac joints and their relationship with the pelvic floor. I'll give you a little bit of anatomy to start with. This is a human spine, and this is a sacrum. These bones here are called iliac bones, and where these iliac bones join onto the sacrum is called the sacroiliac joint. So that's what I'm talking about today. Now, these joints are designed to bear weight from the body above and transfer it down to the lower half of the body. They're also designed to be shock absorbers, and they're also designed to move when we move our pelvis and lift our legs up and walk. So they're meant to be mobile and they're meant to be balanced. Now, underneath here is the pelvic floor. The pelvic floor is made up of a whole lot of muscles and connective tissue and ligaments, and it's basically a supportive sling that holds all of your organs inside. So it's really important that these two things are working synergistically together, because if you get instability in the sacroiliac joints, it affects the pelvic floor. Now, weakness in the pelvic floor can be caused from lots of things. It can be caused from trauma, from dysfunction in the core muscles and the core stability muscles. Now, the important muscles here are the transverse abdominis, the diaphragm muscle, and the multifidi that run down through here. Now, when those muscles are working really well and you're breathing correctly and engaging your core, you're supporting the underneath here of the pelvic floor, and you're also supporting the sacroiliac joints, and they're all working synergistically together. Now, what that does is it creates a really good, strong base of your pelvis, and then it can cope with any forces that are coming down through there. Now, when they're not working together, we get all sorts of problems. Things like prolapse or incontinence and things like that can come from that pelvic floor not activating and not turning on when it should be turning on. Now, things that can cause that are pregnancy and trauma and all sorts of things. But what you can do is you can rehabilitate that by doing good core strengthening and helping to support that whole structure and activating it to be turning on when it should be turning on to provide that core protection. As a chiropractor, I see a lot of people coming into clinic with lower back pain, pelvic pain, sacroiliac pain, pelvic floor dysfunction, leg pain, hip pain, all sorts of things that are generally coming from this sacroiliac joint or the joints associated around it. So some signs of dysfunction in that might be pain in the sacroiliac joint area, glute pain, referred pain down the legs in the sciatic distribution, knee pain, ankle pain, lower back, upper lumbar areas pain, and of course all of the pelvic floor dysfunction that we talked about earlier. When you're rehabilitating this area, it's really important to check that function of the sacroiliac joints, because in humans, we often get a little bit out of balance with our sacroiliac joints, and instead of being neutral, they'll become a little twisted one way or the other. And you might find that in these cases, it's harder to lift the leg up on one side, or it feels like one leg might be a little bit longer than the other, or you might just feel like your pelvis is not straight. Some patients come into me and they say, look, I lay in bed and I can see I'm twisted in my pelvis. More often than not, that's coming from the sacroiliac joints. And there can be any number of reasons for that, stemming from past trauma to differences in anatomical bone length and all sorts of reasons. We won't get into that. But if you feel like you're getting some dysfunction in these joints, it's really important that you have them addressed by a professional. And then once you've had that addressed by a professional, it's really important that you rehabilitate the area and strengthen the area. And the most important thing you can do to strengthen that area is core work. So getting that really strong activation of the core is the best way to rehabilitate sacroiliac joint dysfunction, because having a weak core and having a weak pelvic floor can cause sacroiliac joint problems, and vice versa. So if you have SIJ problems, it can cause pelvic floor problems and diaphragm and core problems. So if you have a problem in one, it can cause the other. So it's really important that you address both sides of that. So the take-home message here today is the pelvic floor and the sacroiliac joints are interdependent upon one another. So if one is overactive or weak or unstable, it will cause a compensation in the other. And this will lead to dysfunction in both. So in order to have healthy function of the pelvis and healthy function of the pelvic floor, you need to have both working in unison together. The most important part of this is that you have a strong core, which makes up all of the diaphragm and the abdominal muscles, and also the gluteals that come around and support the pelvis as well. So when all of those muscles are working in unison and they're activated in the right firing patterns, the pelvic floor and the sacroiliac joints will be functioning correctly. So I hope that helps you, and I wish you all the best on your exercise journey, and I look forward to talking to you again soon.